How to prevent a suicide among prison inmates. If you have a friend or a loved one who is incarcerated, or if you work in a correctional institution yourself, you need to be concerned about the possibility of suicide. Suicide is the third leading cause of death among prison inmates, and many others have thought about or attempted suicide at one time or another. Steps. 1. Be alert for warning signs such as the following. Situational. Recent loss or separation from a loved one. Long or life sentence. Receiving a parole hit. Receiving time in administrative segregation. Chronic or terminal illness. Family history of suicide. History of previous suicide attempts. Psychiatric diagnosis, special needs inmate. Absence of a support network, no letters or visits. Suicide of a friend, fellow inmate, or family member. Cognitive, emotional. Belief that one is a failure. Feeling hopeless and helpless. Extreme guilt about offense. Behavioral. Giving away personal possessions. Change in previous patterns of behavior. Isolating oneself. Hoarding medications. Crying or other indications of depression. Provoking attack from other inmates. Use of verbal expressions such as the following. I can't go on. I've nothing to live for. Nobody cares what happens to me. My life is over. 2. Determine whether additional risk factors are present. In addition to the risk factors just mentioned, the three most important elements to look for in assessing suicide risk are ideation. Does the person have suicidal thoughts? Plan. Has the person decided on how to go about it? And intent. Has the person taken any steps in implementing the plan, such as hoarding medication? 3. Don't be afraid to ask the yes question. Are you thinking of suicide? Or do you want to hurt yourself? Most suicidal people are never free of mixed motives over what they are about to do, and most of them will tell you that they are thinking about suicide if you ask. 4. Get professional help. Suicidal ideation can be a symptom of many forms of mental illness. This information is not intended to turn you into an armchair psychologist, but to help provide an essential link in the suicide prevention process. If you think that one or more risk factors for suicide are present, don't gamble with another person's life by attempting to talk the inmate out of it. You need to immediately relay this information to the prison mental health staff or to someone who will contact them. The mental health staff will assess all the relevant information and, if warranted, place the inmate on suicide watch and arrange for him or her to receive the necessary treatment. Warnings. Every indication of suicidal tendencies must be taken seriously. Even so, called suicidal gestures, which are obviously meant to gain more favorable housing, or more favorable treatment as a special needs inmate, should be regarded just as seriously as if they were a genuine suicide attempt. Those who do not seriously intend to kill themselves could always make a mistake and succeed when they did not intend to. If you are an employee of a correctional institution and you are wondering, why should I care if an inmate commits suicide, or anyone for that matter? The answer is very simple. If you get caught not doing everything you can to prevent an inmate's suicide, you could lose your job, and the inmate's family could sue you, so it would be best to not take the job in the first place if you can't handle this.